So, you've been to the podiatrist for your foot or ankle, and they've taped you up. You know that feeling, right? The big question isn't just, will this help the pain, but is Cigna actually going to pay for this? Well, in this explainer, we are going to break down their official policy so you know exactly what's covered and what isn't.
Okay, so let's set the scene. You're sitting in the podiatrist's office. Maybe you've got a nasty ankle sprain or that plantar fasciitis is just flaring up again. Your doctor says, hey, let's tape this up to give you some stability. Sounds good, right? But then your brain immediately switches gears.
And boom, there it is, the million-dollar question we all ask ourselves, because let's be real, nobody wants a surprise medical bill in the mail. So let's get you a really clear answer, pulled straight from Cigna's own rulebook.
All right, first things first, let's talk about the good news. We're going to dive into the specific times when Cigna gives a green light for taping, and it all boils down to one key idea. And that idea is medically necessary. Now, for Cigna, this isn't just some vague phrase. It means the taping has a very specific job to do. It has to lock down or restrict how a joint moves because of a new acute injury. You can almost think of it like a temporary, flexible cast. So here it is, the most important takeaway. The short answer is yes, Cigna does cover taping. But, and this is a huge but, it's only for the rigid, non-elastic kind. We're talking about that classic, stiff athletic tape that provides real solid support. It's not the stretchy, colorful, kind of trendy tape you see athletes wearing all the time.
So, what kind of injuries make the cut? Well, as you can see here, we're talking about the serious stuff, acute issues like a sudden sprain, a fracture, or painful inflammation like tendinitis. Even specific conditions like plantar fasciitis get the okay. The key is that the taping is treating a diagnosed problem that needs to be immobilized, not just for some general soreness.
And hey, it's not just for your foot and ankle either. The policy also covers your toes for things like fractures, sprains, and even structural problems like a hammer toe or bunions. The principle is exactly the same: rigid support for a real medical issue.
All right, now let's flip the coin. Knowing what isn't covered is just as important, because this is where a lot of people get tripped up and end up with those unexpected bills.
You know, this slide really says it all. See the rigid, classic athletic tape on the left? The kind used to lock a joint down? That's covered. But the colorful, stretchy tape on the right? The kind used for rehab? That is a definite no. In Cigna's eyes, these are two totally different things. And Cigna gets really specific about this. Popular brands like Kinesio tape, KT tape, and even certain techniques like McConnell taping are all on the not covered list. And you might be asking why, right? Well, it's because Cigna considers them to be experimental or unproven. Basically, they don't see enough solid evidence to call them medically necessary.
The reason you're getting taped also matters a ton. If you're getting it done to, say, run faster in a marathon or to prevent an injury from happening in the first place, Cigna isn't going to cover it. And remember, this policy is specific to podiatry. So getting your shoulder, knee, or back taped is a completely different story.
Okay, so you've listened so far and you're thinking my situation definitely fits in the yes category. Great. What now? This next part is all about the practical stuff, how to make sure your claim actually gets approved, because it's all in the details.
Listen, your podiatrist's notes are absolutely everything here. A successful claim tells a complete story, just like you see on the screen. It needs to start with the official diagnosis, say exactly what part of you got taped, clearly state that the purpose was immobilization, and then, finally, mention how it all turned out.
And this isn't just me saying this. This is a direct warning from Cigna's policy. If that whole story isn't laid out perfectly clear in your medical chart, the claim is probably going to be denied. Proper documentation isn't a suggestion, it's a flat-out requirement. And the last piece of the puzzle is how the claim gets filed. It has to be sent in by a qualified pro, like your registered podiatrist, and they have to use the exact right billing code for the procedure. You know, something like CPT code 29540 for foot or ankle strapping.
Okay, we've gone through a lot of ground here. So let's wrap it all up and put a bow on it with one final super clear takeaway. This way, you can walk away from this knowing exactly where you stand.
Let's make it as simple as possible. Cigna covers rigid, non-elastic tape when it's used to treat a new, acute injury to your feet, ankles, or toes. What they do not cover is the stretchy, elastic kind of tape. And they won't pay for taping if it's for prevention or to make you a better athlete. It really is all about treatment versus enhancement.
And I'll leave you with one final, really powerful tip. The next time you call to book your appointment, just mention that you have Cigna coverage.
Any good clinic will already be familiar with these rules. This helps them make sure your treatment and your billing are lined up perfectly from the start, setting you up for a successful claim.